Hello, my name is Nikel Marshall, and I will be discussing Tay-Sachs disease. To give just a quick overview, Tay-Sachs is an autosomal recessive disease, which makes it pretty rare because both parents have to have that gene and the child has to receive that recessive gene from both parents. It's also a lysosomal storage disease, so it is affecting enzymes, specifically the hexa enzyme. And so what happens here, the pathophysiology, is that the deficiency of hexa enzymes causes the neurons to increase in size. And this causes the GM2 to build up, eventually destroying nerve function. And we can see with all of these many signs and symptoms that the nervous system is involved in a lot of parts of the body. And so many things are affected physically and mentally. Eventually, death is usually related to pneumonia because of respiratory muscle weakness and or aspiration because of the dysphagia caused by the affected muscles not neurologically being sound. Interestingly, the onset here, it doesn't begin right at birth, but it actually begins a few months after birth. There are some considerations for testing. There are a few ethnicities that are specifically susceptible, as well as a history of the disease would be a good reason to be tested, especially if there is a possibility of pregnancy and just understanding the risks that you and or your spouse have. The significance to healthcare with Tay-Sachs is mostly management, trying to delay that muscle weakness, prevent aspiration. You're trying to encourage activity for as long as possible. Unfortunately, there is not currently a cure for Tay-Sachs disease, and so most children do pass away between the ages of 2 and 4. As I said before, the first few months of life are normal and there are no detriments. However, after about 3 months, the mental and physical development is affected, which is going to affect sight, hearing, swallowing, and muscle function. Something I'm very passionate about is taking care of the family as well. So like many diseases, Tay-Sachs is very overwhelming, and whether it be parents, guardians, siblings, whoever is affected by this disease, along with the patient, needs support, needs counseling, and they need a good relationship with their physician so that they can talk about their concerns and their specific needs. So currently, as I also mentioned before, there are treatments, there's just not a cure. So there are medications, respiratory care, feeding tubes, physical therapy, all to kind of increase comfort and improve the quality of life for as long as possible. And those will advance as technology advances. Those current treatments will improve. However, there are some potential things on the horizon for treatments that may be closer to a cure. Most of those treatments involve kind of making up for the deficient enzymes, such as replacing that hexa enzyme or increasing the catabolism of GM2, which is what that enzyme does. So you're just trying to make up for the lack of function there. With both of those, enzyme replacement and the substrate reduction therapy, there's not currently any pharmacologics because we just don't have enough information yet. However, there is this Jacob sheep. It's a specific sheep that is nearly identical to humans and is actually susceptible to the disease. So they are hoping to be able to use this sheep to do research to understand a little more, and hopefully here soon have some more treatments and advance medically for these patients with this really difficult disease. Thank you so much for watching my presentation.